Hello and welcome back to our channel. My name is Dr. Kosta Cvijovic. I'm the CEO and founder of Cvigilance, a full-service pharmacovigilance CRO. In our previous video, which we have linked for you here and also in the description, we discussed what pharmacovigilance is in general, we discussed the history of pharmacovigilance, how it came to be, and we discussed that as a result of the thalidomide scandal in the 1960s, pharmacovigilance regulatory bodies and pharmacovigilance systems were set up to deal with drug safety issues. In this video, we want to talk a little bit more about these regulatory bodies. In general, every country in the world has a set of regulations and laws to follow when it comes to pharmacovigilance and drug safety, and every country has a regulatory body that manages and enforces these laws. However, before the country-specific regulatory bodies, we also have above-country regulatory bodies, two specifically that are very important, that issue general guidelines that are not laws in themselves. They don't have to be followed, but they are observed by most countries in the world, and most pharmacovigilance regulations globally are based on these guidelines. These two bodies are called the ICH and the CIOMS. ICH stands for International Conference on Harmonization, and CIOMS stands for Council of International Organization of Medical Sciences. These two groups consist of professionals from the pharmaceutical industry, from health ministries, regulatory bodies, pharmaceutical medicine, clinical medicine, academic medicine, and they all come together to discuss guidelines and issue these guidelines as documents on how pharmacovigilance should be implemented. These guidelines cover a broad array of topics, from case processing to aggregate reports to risk management to signal detection, all of which we will discuss in detail in other videos. Now, after these above-country bodies issue their guidelines, they are implemented on a national level. Some examples of these implementations and national regulatory bodies include the EMA in the European Union. EMA stands for the European Medicines Agency, and it is the regulatory body that affects all countries of the European Union. What is important to note is that the EU is not a United States of Europe. It's not one country. There are different countries in the EU, but all EU member countries have to follow EU-level regulations and all have to follow the EMA as a regulatory body. The EMA is based in Amsterdam in the Netherlands. It moved there from London, England after the Brexit. In 2012, the European Union passed a set of regulations called the GVP guidelines, or Good Pharmacovigilance Guidelines, which are commonly agreed to be one of the most complex sets of pharmacovigilance regulations in the world. In addition to these guidelines, EU member countries also can have additional pharmacovigilance regulations that have to be followed on a national level. And the different EU member countries also have their own regulatory bodies, BfArM in Germany, ANSM in France, and many others. Now, with the EU GVP regulations being one of the most detailed and strictest in the world, many countries follow them as a basis for their own regulations, either in part or in full. But it is not to be said that that means that no country has stricter requirements in some areas than the EU. Some Asian countries in the past implemented even stricter requirements than the EU mandates in certain areas. So whenever you're working in a specific country, it is very important to familiarize yourself with the current local regulations in pharmacovigilance in this country, as regulations do change and you want to make sure that you are compliant. Another example of an important regulatory body is the United States FDA, the Food and Drug Administration of the United States of America. This body tends to have its own set of regulations in pharmacovigilance that are similar to the ones in other countries in the EU, as well as the recommendations of ICH and CIOMS, but they do differ in some areas. So when dealing with US pharmacovigilance, it's particularly important to adapt oneself to the different pharmacovigilance landscape that exists here. We're also going to cover that in further detail. Now, broadly, what pharmacovigilance regulatory bodies do can be divided in two parts. First of all, when a drug is being developed, they make sure that the clinical trials used to develop this drug are being safe and that any safety information from these clinical trials is reported to the regulatory body so that an assessment of safety can be done in real time and that the health of the patients participating in the clinical trial is not put at an unnecessary risk. Once there is enough data from clinical trials to warrant submission of a marketing authorization, these regulatory bodies are where the marketing authorization is being submitted to. They review the safety data along with the efficacy data and other important data, but here we're focused on pharmacovigilance and safety. And if it is sufficient and if the medication has a good benefit-risk profile, then the medication will get approved. Here, the term benefit-risk profile is critical, and we will discuss this in further detail in other videos. But the important takeaway is that a drug's benefit have to outweigh its risks. And benefit-risk assessment is done differently for different types of drugs. For example, an oncology product will have more tolerable risks than a product used to treat the common flu. Once then a drug is approved, pharmacovigilance doesn't stop. In fact, this is where it actually takes off. There is a ton of requirements for any company marketing a drug in any country in the world to make sure it continues to be safe and the benefit-risk profile is being monitored. We're going to discuss specifically these requirements post-marketing in other videos. So, this has been a summary of the global regulatory bodies, what they do in general on a very high level. We're going to discuss some other aspects, such as individual case reports in other videos, and we have a number of trainings available on many different topics. Feel free to check them out in our description and on our website. Thank you so much for watching. If you like the content, please like and subscribe, and please comment on what other topics you would like to hear about here.